The trial of Lindsay Clancy is sparking a national conversation about postpartum mental health. Clancy is accused of killing her 3 young children in her Massachusetts home. Prosecutors say she did so deliberately, but her defense argues she was suffering from postpartum psychosis. It's a rare but serious condition affecting less than 1% of women after childbirth. Experts say many women still face barriers to care that may complicate treatment. This morning, we're joined by Dr. Kameelah Phillips, a board-certified OBGYN and the founder of Kameelah Women's Health, and Dr. Birndorf, a psychiatrist and co-founder of the Motherhood Center. Good morning to both of you, doctors. Let me start with you, Dr. Birndorf. Is this a public health crisis?
Without question. Mental health, maternal mental health, is the leading cause of maternal morbidity and mortality, so death. The leading cause of death during pregnancy, birth, first 6 weeks, and the first year postpartum.
I think people will be stunned to hear that. And Dr. Phillips, we were talking about this. For many people, they acknowledge right after birth and giving birth, it's a tough time. It's having 3 children myself. But what is the difference between depression and psychosis?
Right. So depression is actually quite common, about 10 to 15% of deliveries. But it's a sadness, it's a lack of bond or connection with your baby, crying. It's treatable, and we can have those discussions. But postpartum psychosis is actually a medical emergency.
Yes.
This is when women are hallucinating, having delusions, thoughts of harming themselves and the baby. And that bandwidth to realize what reality is versus delusions is gone. And that's why it's dangerous.
And Dr. Birndorf, kind of more specifically, what are the warning signs from the outside, right? Because I think a lot of spouses are watching this thinking, you know, when is that moment where my gut is telling me something is wrong? But also, what does it feel like as a woman going through it?
Yeah. Well, I think that for those on the outside, you can't always see it. I think when someone's crying and telling you how horrible they feel and they're overwhelmed, like in a depression, you can see that and you can say, how can I help? But sometimes women are scared to share because they don't want to be deemed crazy, so to speak, right? And so they don't want to be thought of as having, like, what if I tell somebody if I'm having a thought that seems out of touch with reality, they're going to take my baby away. Something bad's going to happen to me. So there's a lot of fear around even speaking ill of being a mother, right? Society wants us to feel great about it. It should be the best thing that ever happened. But in fact, it's an enormous challenge. It is both and. It is both wonderful and complicated and challenging. And that nuance is hard to hold, and it's hard to speak about.
I think this case has captivated everyone's attention. All of my friends are talking about it because they understand the difficulty. They know that they've had friends that go through this. And Dr. Phillips, you think this is actually going to get worse?
I do. I don't think that America is paying attention to what's happening in women's health. We are losing doctors in droves. The funding is not there to support maternal health. And this piece of mental health is being completely ignored. We have about 35 counties in the United States that have 0 OBGYN or healthcare providers. These women's health deserts are going to set us up for failure in the near future if we don't start acting and talking about this really pivotal issue.
And it's not just that. These deserts and less medical students are going into OBGYN residencies because of some of the things that have happened since the Dobbs Supreme Court decision. But on top of that, the whole system is not built up to take care of women after they deliver a baby. Explain that, and how should we all be aware of that so we can help?
Well, education and training is way not happening. So doctors like us, it's hard to get the education and know about what this is, right? There are OBGYN deserts, and there are even less mental health services in areas across the country. We need more services, we need more education, we need screening, we need access to care, and we need treatment centers that are specialized in treating these illnesses.
Yeah, it's my understanding there's only 5 of these specific treatment centers for this in the country. But what about that? After you deliver a baby, you're constantly taking the baby back for those visits. But a mother's postpartum visit doesn't happen until what week?
6 weeks.
So 6 weeks after having a baby?
Too long.
This is a major flaw. This is a major flaw in our healthcare system. Really, mental health should be woven into your care before you have a baby, during your prenatal care, and especially afterwards. You described it as a hormonal tsunami. That's exactly what it is, and that's when you need the most support. So not only from friends, family checking in on you, we need our social services, we need our churches, we need our whole community to attend to the mother. Babies are cute. Someone's always looking after them, right? But no one is looking after the mother, and this is where we are right now.
Well, and to that point about the before part of it, because, you know, I'll be honest, my husband and I, we are at the beginning of this journey thinking about starting a family. But I also know that if you have experienced a depressive episode prior to getting pregnant, you are more likely to experience this. I have struggled with depression along with millions of American women. So what are the things that someone who has gone through this should be doing differently? You know, we talk about creating a birth plan. What about creating that mental health plan?
That's the best thing you can do, to talk to somebody, to get your services lined up. If you have a history of any kind of mental health issue, you should be getting ready for what could happen, because it can happen again, particularly if it's happened before. Family history, personal history, stressful life events. These are risk factors for people having depression, anxiety, and other illnesses during and after pregnancy. So you're so smart to talk about it, to get ready for it, to find out, what services do I need to be in therapy? Do I need to be on medications? Do I need to consider those things? What should I do to make sure that I'm in the best stead when I have this baby?
And I think it's so important for women and others to remember that this is completely normal and happens. Yes, there is no shame in this at all. And we've got to change the system to be so focused on women's health post-birth. What can be done to do that?
Listen, I'm always an advocate of voting, right? So voting in an interest that serves women's health is critical. I think we also really need to challenge these insurance companies. What good is having insurance if they don't cover your psychiatric therapy, if they don't cover your medications, if they don't cover your admissions? What use is it? And I think that we have to keep having these conversations to remove the stigma of mental health. We all have our issues. Mental health is the same as your heart health. So why do we separate it? Why don't we fund it? Why do we isolate it?
Dr. Kameelah Phillips, thank you so much. Oh my God.
I get that.
You're terrific, and I've so enjoyed our conversations here and off camera as well. Thank you for changing the conversation. Dr. Catherine Birndorf, thank you so much.
Thank you both so much.
Thank you.
And a reminder, you can catch Nora's special, Healthful podcast about postpartum psychosis on Friday. There's also a new episode out today featuring trainer Kira Stokes, who spoke about the importance of weight training.